So thanks very much to CAI and Cody and Rosemarie for having us today. I'm Milton Cohen. I'm the CEO here at Caring Closures International, or CCI for short. A couple quick things before I jump into our presentation. Number one, I'm joined by Zach Molnar, our finance director, who's with me here today. And number two, this is a very, very high level presentation, queued for about 5 minutes. We do a much deeper dive with people, with interested parties, that covers more of your standard normal investor presentation items. And so this will be relatively short, but I welcome all your questions at the end. I'll go ahead and get started. Here at CCI, we are applying a long forgotten yet proven intervention of the past to solve today's public health problems. And that intervention that I'm talking about was now over 50 years ago. And just to provide some context on just how long that's been, I like to start off with rewinding the tape back to 1970, when, as you can see here on the left, the Chiefs won the Super Bowl IV. Or Elvis Presley, the king of rock and roll, was still alive. That's him visiting Nixon in the Oval. It was the first Nixon administration, and so Watergate was literally still just an office building. And then finally, over here on the very far right of your screen, back then in the 60s and into 70s, we had a massive epidemic here in the US with children overdosing on aspirin. And you may scratch your head, but aspirin's bitter to the taste naturally. The kids wouldn't take it. Mothers complained. Manufacturers flavored it like candy in response. And as soon as they flavored it like candy, kids started taking it like candy. And you can overdose on aspirin.
I did that, by the way.
I don't know. I had Bayer. You may have had St. Joe's. That's the leading brand pictured there, Rosemarie.
Yeah.
But they were good. Fast forward, this issue led to the development of the child-resistant cap and closure, which proved access control as an early intervention, generating at the time a 45% reduction in US child mortality from drug and supplement poisonings. 45%. Such an effective intervention that the entire world implemented this standard. And so today, while all the world follows this 50-plus-year-old standard, the entire world has long forgotten this important lesson in access control. And so where everybody else just sees everyday packaging and the normal items we use day to day, here at CCI, we see an opportunity to modernize this intervention of the past to help solve the epidemics of today. Like the opioid epidemic here on the left, where sneaking pills or pilfering is not just a leading source of diversion in household and institutional settings, but also the #1 source for teen drug abuse in our country since 2012. Or the resurgent pediatric poisoning epidemic, where every 8 minutes, a child goes to the ER from a drug or supplement poisoning here in the US, or every 12 seconds, a child is poisoned from a common household product. These cost our healthcare system billions of dollars a year, and our economy tens of billions of dollars a year, and literally all of them can be contained with simple access control. So we've started with prescription drugs with our SafeRx line of locking prescription vials used by pharmacies in dispensing controlled substances in our teen-proof version pictured there on the left, and ultimately by pharmacies in dispensing pediatric fatality risk meds in that coming 2-ring child-proof version shown on the right of your screen. And so we launched the teen-proof version in late 2021 into US healthcare. We're now up to over 100+ customers across 6 different verticals. All of this pre-reimbursement. I'll say again, pre-reimbursement. We tripled healthcare revenue last year. We're on pace to quadruple it again this year, with 60% of our budget for the year already quoted in our pipeline, literally the last stage in our pipeline before customer PO. And we expect this rate of growth to accelerate rapidly with reimbursement. Using a new code set, the UDI code set just approved by CMS last November. You can see the stakeholder economics are quite compelling at the top here. We have 5 clinical trials underway, including one by a QIO for CMS, and then 2 that are being run by the Bloomberg School at Johns Hopkins. Overall, SafeRx is about a $5 billion revenue opportunity globally at 35% plus EBITDA margins. And literally, if we just used it for opioids alone, we'd prevent 7 million 12 to 17-year-olds from initiating drug abuse over a 10-year period. 7 million teens. But it's not just about SafeRx alone. In the longer term, we expect to license our IP. We have 11 issued patents and 2 pending into consumer product packaging for another $1 billion in revenue at very, very high margin with very high levels of distributable cash flow, and literally potentially creating a world in which kids don't ever go to the hospital again from a poisoning event. We're here today. We have $1.5 million left in our convertible note and safe round. The terms are pictured here on your screen. In terms of our capital stack so far, we've raised 12 million. We have healthcare, pharmacy sector executives, social impact funds and families, and YPO colleagues of my own invested in the capital stack. We'd love to have any of you that are interested schedule some time with us and look at potentially joining us in the last $1.5 million in this round. I just finished by saying, Cody, Rosemarie, and everyone else, 10 years from now, I would expect our cap and closure technology to be as ubiquitous as child-resistant caps and closures are today across the planet, ubiquitous. And if we're successful doing that, we'll have saved tens of millions of our children and teenagers. And so thank you very much for listening today. I hope that some of you will reach out and join us ultimately in this important mission. Thanks very much.